Yes, well, the most common used classification is, as you know, the AO classification. This is based on native radiographs, and it's a classification so that we know what we are talking about, but it does not help us in any way to create a treatment concept. Yes, of course. I remember when I was a young surgeon, we used only K-wires for fixing radius fractures. And then when we got the first plates for palmar dislocated fractures, today, when we follow a fracture-specific treatment concept, we have many different plates available to be able to treat the different types of fractures adequately. CT diagnostics have become standard, especially for intra-articular fractures. We use the axial slice as the base for classification. Sagittal, frontal, and lateral slices help us to get a three-dimensional understanding of the fracture. Finally, 3D reconstructions complete the picture in our mind, especially for central impacted fracture types. Recently, 3D prints of the fracture have also been helpful to try out specific plate types for fit. No, we still need standard X-rays. It's clear to get the general overview of the type of dislocation of the fracture. Yes, our classification is based on the CT-based concept of Brink and Ridley and the osteoligamentary fracture concept of Craig Bain. We have added corresponding treatment concepts to the systems and refined the details for a better understanding. The main difference is that we have a treatment-oriented approach as opposed to a purely descriptive classification. We have decision support for the surgeon on which approach to choose and which plates can be stabilized with specific fracture type. Well, the surgeon needs a biomechanical understanding and to be able to interpret the fracture lines correctly. Only this leads to a concretization of the key fragments and to correct treatment conclusions. In my published work, all the essential principles for this biomechanical understanding are presented. If anyone uses this classification, he can plan his fracture treatment and possibly order the correct plate if it's not available. And it will also be available as a web-based version and thus accessible in any situation. Yes, in my opinion, Medartis offers a complete portfolio of different plates to treat all types of these fractures. Definitely the rim fractures, which are very easy to miss and also very difficult to stabilize. Especially for this, Medartis has created very special plates to treat these fracture types and these really small fragments. As we all know, the fractures in old people are mostly comminuted fractures and are difficult to classify and often do not correspond to the schemes shown. Nevertheless, basic features of these fractures can be recognized also in this classification. Of course, there are also fractures that are not really represented in this classification. Here the question arises, is such a complex fracture that nothing is identifiable, or do we have also identifiable fragments that are not key fragments, but can still be addressed with one or more plates? In the worst case, the fracture can be breached externally by a fixator or what is now preferred by a spanning blade.